The West Virginia Department of Human Services recently provided data showing a drop in overdose deaths across the state. 12 News' Jalen Lamp spoke with the state's Director of Drug Control Policy about what's behind the change.
Between January and October 2024, West Virginia saw a 40% decrease in drug overdose deaths compared to 2023. So what's working for our state? West Virginia's Director of Drug Control Policy, Stephen Lloyd, says the decrease is the result of access to overdose reversal drugs, the statewide increase in quick response teams, cooperation among law enforcement, access to treatment and rehabilitation, and one of the biggest reasons, our state's sense of community.
But the sense of community in West Virginia is unlike anything that I've seen. And I really see that in our communities and people pulling together to look for solutions to help families suffering with addiction. Now, we still got stigma and we still got things we got to overcome. But those are the things that I see. And we talk about it openly.
West Virginia saw its highest drug overdose rates during COVID, and Lloyd says it was due to treatment and access options being limited. Correctional facilities played an important role in the decline, providing medication-assisted treatments and aftercare plans for people in need, as the risk of overdose increases 2 weeks after being released from prison.
But we were the hardest hit state. We were targeted the hardest. And now other states are looking for us to how to come out of this. And I have to admit, I'm a bit of a romantic. I love the idea of West Virginia leading the way out of it.
West Virginia's 40% decline surpasses the national average of 26.5%, which, according to the Department of Human Services, translates to 468 people who are still alive. The state's decline also led to a significant decrease in children entering the foster care system. As for how legislation can help keep the downward trend going,
don't tear down what we've already built. And let's look for the holes in it and see how we tie it together and draw quality providers to our state rather than blowing up what we have. That will not work, and we will hurt West Virginians. And that's my message to our legislators.
For 12 News, I'm Jalen Lamp.